moderator for this panel is going to be our lovely co-host, Kristen Winters. So she's usually on this panel. Now she's going to be hosting it. So it's kind of going to be an amalgamation of roles for her. So I'll let you guys get started and we will go from there.
Yeah, Peter had said he had some disconnection issues, but he was going to log on. So we'll hope he pops up. But I'm glad to talk to you guys today. I know, Mary, I've seen you recently, so nice to see you again. I was going to let you guys introduce yourselves first. So let's start with you, Mary, and you can just tell us a little bit, one-liners, and tell us about yourselves, and then we'll give Peter some time to log on too if he's coming in.
Definitely. So I have just a quick disclaimer. Anything I say is not represented from my company. So there we go. We got it out of the way.
This whole thing, yes, the whole thing is your opinions and that of yours.
Exactly. Yes. It's just an opinion. All right. So we got the disclaimer out of the way. I'm Mary Lassiter. I am the campaign management lead. So I'm at the global level for Sanofi. And so basically how it relates to CX is that when we design something in a global level, we look at both our internal customers, which is our marketing teams, our brand teams, our IT teams, on how we deploy the technology, but we also look externally at how the customer interacts with the software that they're using and how does it actually all architect together behind the scenes so it's a seamless experience. So that's a little bit about me.
Thank you. And Ray, how about you and your role within Populus?
Thank you, Kristen. Yes, I'm Ray Rotolo. I am the co-founder and chief product officer for Populus Media. We are a virtual patient acquisition platform. So literally everything we do is surrounding CX in some way, shape, or form about creating better patient engagement, better patient experience within virtual care. So telehealth being the primary driver of that. So everything we do is surrounding to create a better overall patient experience, which we believe leads to better patient outcomes, which is better for everything that we do, whether it be through the marketing components of our platform or through the general patient outcomes part of the platform as well.
Yep, cool. Thank you. I think, I think the one thing, looking at this and thinking about things to talk about, right? So emerging technologies and focusing on patients. I mean, we all know that everybody's using technology every day in everything that we do now. More than ever. And so pharma marketers are constantly challenged with how are we delivering messages in ways that will capture patients' attention, but we also have to be informative and we have to be compliant. So can each of you, I guess, Mary, we'll start with you on like how technology is helping you deliver that information to patients and how is it going for you? How are you using it now?
Definitely
helping them.
Yeah, so I think there's been a lot of emergence right now of a couple of different aspects. But first of all is like messaging apps, right? So that's kind of an emerging technology that pharma is just getting our head around, specifically around like WhatsApp. I know there's Telegram, there's WeChat, but how do we now take that inside and take the data that's coming in and automatically transfer it to kind of a message? And I know our last panel was talking about chatbots. So same thing with a messaging app. How can we start to integrate that and look at that a little bit differently and offer up those recommendations to kind of further the experience along within the patient or even the HCP world?
Yep. I guess, Ray, do you have a perspective? I know you guys work with this daily. So how are you seeing it improving a patient's experience?
Yeah, I think Anna made a really good point in the last panel as well about technology and humanity, so to speak. So a lot of the things that we do, we try to make sure that we understand first and foremost that we don't try to fit the patient into the technology or the consumer into the technology. We try to fit the technology with the consumer. I think we always make sure that we keep the patient first in everything that we do. And as we create these content and messaging modules that we insert into telehealth visits and other things that we try to do, it's all about making sure that the patient is first and foremost, and that it's about creating, as I said before, that better overall patient experience. So we do that a number of ways, and we try to, again, first and foremost, focus in on creating that experience through education and content. So it's making sure the patient is educated, having the ammunition they need to create a better overall visit when they speak to the HCP, speak to the doctor. So it's about content first driven strategy and enhancing that experience through content and having that brand supported in marketing. And with marketing, it's just an added part of that and having the brand associated. But it's all about content driving that experience.
Mm-hmm. Yeah, that's true. I mean, we're consistently saying, right, you need a content strategy, which is more than just one message, right?
Yeah.
It's really thinking about what's a series of messages to educate, regardless of customer, I think, at that point. And I think, where do you guys see some maybe challenges that you're experiencing? So where is the patient experience maybe not so good? And maybe where you're seeing technology maybe gets in the way? I was thinking that might be good to know so that people have know the hurdles that are out there.
So I think that there's a couple of hurdles. First of all, any technology that you use, there's always a learning curve. So you got to find out where they're at. So if a patient is on WhatsApp, then how can you legally do that within a pharma company? So I think sometimes the regulation sometimes gets in our way. And also what we're allowed to do. We're in a regulated industry. So sometimes when we want to use some of these emerging technologies, we have to go through a complex legal process. So trying to navigate that. And then also there's consent and privacy. So understanding how those applications, capture consent, even with WhatsApp, even though you're using a phone number, we've got to capture that consent as well too when you're using a different technology. So those are some of the challenges that, I face on a daily basis of how do we start to have that balance between the regulatory part of pharma, but also how do we do it in such a way that we can communicate with the patient where they're at the right time, the right place, the right platform.
I couldn't agree more with Mary. I mean, especially considering where we're sitting in virtual care, with telehealth being at the forefront of that, it's such a new platform. It's such a new way for patient HCP communications that there's an education process on all sides. The patient obviously is still getting familiar with the understanding of not seeing a doctor face to face in that regard. How do they interact? What's the outcomes of that interaction, etc. And then also on the regulatory side of this, especially into some of our clients and the pharma brands that we work with, and how we process through MedReg and all of that stuff. So it certainly is all of the above, and I 100% agree with Mary that it's that process of going through all that, especially with new technology such as telehealth and virtual patient information.
Yeah, I think sometimes you're trying to find, like you said, like it's where the patients are at, but then even then I find even hearing from patients that they're struggling to hear from us more, and we're struggling to try to get stuff out to them because it's just so much regulation that you're constantly kind of battling up against, or trying to figure out how to maneuver within a new platform it's always a lot of work. And I think that's really the internal, like the regulatory and compliance side of it. Have any of you taken some steps with the data and analytics? I know there's always lots of data. So how are you guys maneuvering through the seas of data that are available, but then trying to inform how you move forward?
Yeah, I'll take this quickly. I mean, we're doing the crawl, walk, run scenario with regards to data, right? We're a fairly new platform. We've only been around a year live in the marketplace, so we're working really slowly and trying to understand what our partners will allow us to have. Right, our partners are the telehealth companies for the most part, who are new to content and marketing. Right, they're primarily technology companies, so we're trying to have them become more familiar with the process of what we're trying to do with regards to patient satisfaction, patient engagement, and ultimately driving that brand marketing interaction. So it's a crawl, walk, run scenario of let us understand what we can utilize, and then translating that back to our brand partners and say this is what we can provide back to you. So right now we're operating at a pretty minimum with regards to data that we're bringing back, but we do believe that this will continue to grow as everyone becomes more comfortable with telehealth as a ongoing platform, and we get through a lot of that initial kind of understanding.
Yeah, and on both sides, right? So it's like whether
Absolutely.
It's the client side and even the patient side trying to
Yep.
get in and use it. I think we're seeing the
Yep.
growth there, but everybody's going to get more comfortable with it, I think, as time goes on.
Mm-hmm.
Mary, did you have any thoughts on the data side of things?
Definitely. So one piece that I'm always trying to look at is how does the data relate to the customer experience? So when the patient interacts with the platform, how was their experience? Was it good? Was it bad? Was it frustrating? These are hard to grab out of that one interaction with them. So, something that, I know companies are doing, even pharmacies right now, they're offering that survey right after that experience, so we can understand better, even if it's just even an NPS score of 1 to 10. How are you doing? Did you enjoy your experience today? It gives us insight into how we can better, as marketers, as in IT better basically accommodate this virtual experience that we're going through, and obviously make it so that there's no barriers in that customer experience. And I know every company has this vision of how do we make that positive digital customer experience. And so it's tying that data, being able to democratize it, and being able to spread it throughout, not only getting the sales force to use what data is coming from marketing, but vice versa.
Yeah, that's true. And I'm just going to take a chance to say hi, Peter. Welcome to the panel.
Hey, everybody.
And glad you made it.
Thank you. Yeah.
Tell us.
It's always ironic when you're talking about emerging technologies and you struggle with the basics like mic and camera on. So happy to be here. Glad to join the discussion, and actually jumping right in relative to the data conversation too. I think within there too, it also becomes an evolution in terms of how we're defining the benchmarks and KPIs for data in terms of how it impacts CX, right? We've always held to this notion that certain KPIs are more impactful than others. And I think we need to evolve what that looks like, right? Especially if many of the instances are only one-off interactions from there. I think to Mary's point, qualitative insights from the customer are always good, but being able to define a clear understanding of the quant end of that too will help us build out that interaction better. Yeah,
that's great. And I think, can you tell us a little bit about what you do, since we hadn't had a chance to hear from you yet? At Novo.
So I lead the emerging technologies team within omnichannel marketing. So we are tasked with maintaining and optimizing the collective digital ecosystem. So if it is a digital tactic that touches the field, HCPs, patients, or payers, my team manages that. And we facilitate the integrations for new platform stand-up, as well as future-proofing current applications as well.
That's great. I mean, so these guys have touched a little bit on it too, and just some places where you're seeing patients are responding well, or places where technology might be getting in the way. That's if you have a few tips on that, share.
So I think the biggest part is relative to the content that's being distributed and how the content is being distributed, right? I think within marketing, particularly pharma marketing, I think we really love our content, right? We think it's the most amazing content that's ever been created in the history of the world. But I think what we need to do is really meet the customers, particularly patients, where they're at, right? Smaller snippets, more impactful and relative to either the disease state as a whole, but that tied to with also branded customer experiences within a mobile application more so. I think particularly within certain spaces, we think it's an older population, so we may think they're not as tech savvy within that or digitally savvy. I think we need to be able to bridge that gap between how content is delivered and then the application that they're using within there. I think emerging tech is one of those areas where we start to kind of narrow the throne between what once was, and where we're going with everything.
Yeah, it's funny you say that too with the age groups, because I think that we forget we're all getting older, but we all know what technology we're using. Yep. So even my 87-year-old dad knows how to use his iPhone really well. So it's like, it's okay. They're going to catch on. So
if I could just jump,
go ahead, Rick.
If I could jump in there real quick, I 100% agree with Peter, and it's one of the things we do with Populus is we absolutely focus in. I mentioned before on the patient experience within the virtual care world, but everything we do is relevant to that patient. Relevant meaning if they're visiting a doctor for a specific reason, that's what we center our content and marketing strategy on. So it's all about understanding why that patient's there and enhancing that visit with contextually relevant content. That's the way we keep patients engaged. That's the way we keep patients educated to go through their visit in the most powerful way possible. So I 100% agree. It's all about contextual relevance. Otherwise, we lose everything with regards to how we're talking to them.
Yeah, and I always say the same thing about content. I think we struggle a lot with trying to break it down. So are there any tips you guys have on how to chunk it so that it is easily delivered and easily received?
Yep. So from our end, if I go first, so what we're doing is identifying content that resonates across audience and building it out within applications so that we can synthesize that content across multiple channels, right? Because we know within pharma, the biggest hurdle is always the MLR part of it and how quick we can deliver content that's approved to the marketplace. So the way we're structuring that is within content fragments that can be completely usable across multiple tactics and potentially multiple audiences as well. So then we pick that content up. It's then built within the application and delivered. So in that point where we're looking at review cycles that may have taken longer and content in development might have taken longer. We use the data to drive how we're updating the content and then how quickly we can update it across different tactics and channels.
That's great. Mary, do you have any insights on that as well?
Definitely. So a couple key assets is basically using a data asset manager, but then also you want to link it into, we've all talked about templates, how it can be efficient, but now I think it's moving to a modularized template. So you can drag and drop it not only on a website, but in an email, but in a, WhatsApp message, being able to do that and then tying all that data back. Hey, did that headline work? Based on that module. It's going to speed up the process with the MLR. It's going to speed up the process with the regulatory when you have that modularized template. So looking across all the systems when we're architecting it, coming in and saying, hey, we know content is king, but how can we now maximize that content across multiple platforms without having to go through med legal review on every single little piece of it? So that's something that we're trying to look at as a whole is how do you do this in a modularized fashion?
Yeah, because I agree. I think when you're looking at that, template has developed such a dirty word over the years when it comes to content and how efficient you can be with that. But I think that not only impacts how quickly content can be delivered to the audiences, but it also creates a level on the back end of ROI for the organization. Because if we see content being structured quicker and used across more applications, at the end of the day, that development cycle is lower, and that gives us dollars to spend in different marketing innovations versus just content management.
And speaking from the partner side of this, we absolutely hear that and understand that. And that's why everything we try to create is modularized. So we make sure that we understand that and our platform is flexible enough that we can accommodate as needed the needs of our partners and our clients alike. So it's a matter of making sure that we're prepared to be part of all of that process.
And I know we had a question posted. I know, Mary, you kind of touched on it in the beginning, and I know it's legal definitely, but privacy is usually a separate group. And do any of you guys have tips on how you've dealt with managing the privacy expectations, managing privacy through use of new channels, things like that?
So I can go first on this one. So I've worked in a couple of different areas in my past life of how you kind of capture this. So it's always important, at the beginning that you have something that captures it, but also making sure that the patients understand what they're ultimately getting into. These are key aspects that we've noticed along the way as kind of a key part. And I think when, we think about HIPAA or we think about all the privacy that goes in place, especially now when we're talking about GDPR from a global standpoint, but also we have states like California, Massachusetts that are coming in with new laws. How do we ultimately bridge that gap and collect the data in a way that's consented, that is clean, that we can ultimately message the patient on it, but also what platform? So these are all these questions that have to be answered up front when you're starting to architect what that solution looks like across the board. Is there an easy answer to this? Probably not. It doesn't matter what platform you use, you got to solve this problem within any organization.
But I think that to Mary's point, I think it starts with transparency and making sure that we're transparent in everything that we do, especially with the patient, and making them understand exactly what we're trying to accomplish and what we do. So we approach it in that respect with transparency first, and also other things we try to do is at least on our platform, we don't see, store, or collect any patient identifiable information or any patient health information. So we stay fully compliant in that regard. But I think ultimately it's all about making sure that the patient is aware of what's going on. That way, in the end, you're kind of you're prepared for anything, whether it be GDPR, whether it be CCPA, HIPAA, or anything of that nature. I think transparency is really the key.
Yeah, and I'll echo Mary's point too within the architecture side of things and making sure that you're accounting and aligning with your privacy and legal counterparts. And because collectively, I think across most of our universes, we have a lot of integrated platforms that at times don't play nice together. So the goal is how to architecture that so that you're not only accounting for the current mandates within legal, but what could come down the pipe as well.
Yeah, and I think always to the transparency part, also the give and take of what I'm taking from the patient to what I'm giving you in terms of the information you get in response to whatever data I get kind of the equal amount back kind of thing is always a law of how to proceed nicely with the patient or a customer experience. So that's good. Well, I thank you guys very much. I think we are headed off into I gotta just check my schedule because now I realize headed to a break. So I was like, I think we're headed to a break. So that was the only question I see. And I don't see any other questions posted. So I want to thank you guys very much for your time. This was very nice to talk with you guys again. And thank you for hopping on and sharing your insights.